Hello, everyone, and welcome to the Model Aquatic Health Co Network webinar. My name is Daisy Galan, and I'm here with the National Association of County and City Health Officials. It's a pleasure to have you join this webinar. Today, we're going to be talking about healthy and safe swimming at public aquatic venues during the COVID-19 pandemic. I want to remind you that there are two ways you can listen to this webinar. You can either listen through your computer speakers or call in using the call information here. Given the high number of participants to today's webinar, I will ask you to choose one of the two so that you are just connecting via one of the options today. You're welcome to submit questions throughout the webinar. We ask you to please use our Q&A box. You're welcome to submit questions via the chat too, but the Q&A box, it's our preference. And I also want to remind you that this webinar is being recorded, and we will be sharing the recording with all the registrants following up after today's webinar. So with that, again, I just want to welcome you, and I will pass now the word to Joe Lako with CDC National Center for Environmental Health, and Joe will be introducing our speakers for today.
Welcome, everybody. As mentioned, my name is Joe Lako. I work at CDC's National Center for Environmental Health, and we've partnered with NACCHO for several years now, promoting the MAC, including this forum of the MAC Network webinar series that we put on, at least been trying to do that at least quarterly. And today is a hot topic of what it's going to look like when jurisdictions decide it's time to reopen their aquatic venues. We have a panel of excellent speakers today. I'll go ahead and introduce all three of them together and then hand it off to our first speaker. Our first speaker is Dr. Jennifer Murphy. Right now, she is the lead of the water sanitation and hygiene team for CDC's COVID response. In a regular day job, she's an environmental microbiologist in the Environmental Microbiology and Engineering Laboratory team and the Waterborne Disease Prevention Branch. She has over 20 years of research experience in designing and conducting studies that include microbiological, chemical, physiochemical testing of water, and other types of environmental samples. She's also performed laboratory-based studies of disinfectants for use in waterborne disease outbreaks. Our second speaker is going to be Michele Hlavsa, and she is the chief of CDC's Healthy Swimming Program. Michele and I work together quite a bit on MAC-related issues. And her area of expertise includes recreational water-associated illness, particularly cryptosporidium. She's worked on a number of outbreak investigations and rec water-associated illness and collaborates with U.S. and international public health authorities and the aquatic sector to develop science-based prevention and control measures. I think it's also important to note that Michele is also an RN, which I always think is pretty cool to have as part of these discussions. Dewey Case is going to also provide some input here. He is the technical director for the Council for the Model Aquatic Health Code, and he has quite a bit of experience working in the aquatics realm, and particularly working for the YMCA of the USA, as well as local and state chapters of the American Red Cross by providing expertise in aquatics. And he has a hold of one of the reins, along with Christy at the CMAHC. So we do a lot of work with Dewey and the CMAHC as we manage the upcoming 4th edition of the Model Aquatic Health Code that will be due out next summer. So with that, I'm going to hand it over to Jen Murphy, and she's going to talk about some of the guidance that we put together for operating an aquatic venue in this new world of COVID-19. Jen?
Thanks so much, Joe, and thank you all for the opportunity to speak here today. I think the first thing that's going to happen is Daisy's going to open a poll to find out when you will be opening your aquatics venues. So I think that might come up. There we go. Okay, while you're answering that, I'm going to go ahead and get started. So again, my name is Jen Murphy. I am working on CDC's COVID-19 response as a team lead for the water, sanitation, and hygiene team. So I look forward to giving you a little bit of situational background on COVID-19. A lot of this you may already know just from watching the news and staying on top of this pandemic. And then I'll turn it over to Michele, who's going to go through some of the more specific aquatics information that we've just put out on our website. So next slide, please. Okay, so quick overview. Just like I said, I'm going to talk a little bit about the disease itself and some prevention messages that CDC has put out. And then I'll go a little bit through cleaning and disinfection. That's a big question that we get a lot. And then that's when I'll turn it over to Michele, who will be going through our recent considerations for public aquatic venues document that we've just released in the last a week and a half, 2 weeks. So that's kind of broken up into 4 main areas that she'll go through. So promoting behaviors that prevent the spread of COVID-19, maintaining healthy environments, maintaining healthy operations, and then preparing for when someone gets sick. And then we have a list of some of our CDC COVID-19 resources at the end. So you'll be able to hopefully get the slide deck from the organizers and have a way to get to some of these references that we're going to go through today. Next slide, please. Okay, so starting off with COVID-19 disease and prevention. Okay, so as most of us probably know, this disease is caused by the virus SARS-CoV-2. This is a novel coronavirus. The first US case was reported on January 21st, 2020. And as of yesterday, our case numbers are 1,551,095 cases. And we have just a little over 93,000 deaths. So cases have been reported in all 50 US states and 8 US affiliated jurisdictions. And I have a link up here that you can click on, and that gets you to our case counts, and those are updated daily. So you can watch those case counts on the CDC website. Next slide, please. Okay, so first I want to just talk a little bit about how this virus spreads. So the virus is thought to spread mainly from person to person. So this is between people who are in close contact. So we say within about 6 feet. And we know that the virus is spread through respiratory droplets, and these are produced when someone who's infected coughs or sneezes or even talks. And then these droplets can then land in the mouths or noses of nearby people and can possibly be inhaled directly into the lungs. We also know that people without symptoms, so asymptomatic people, may also be able to spread COVID-19. And then we also think that people may be able to get COVID-19 by touching surfaces or objects that have the virus on them, and then touching their mouth, nose, or eyes. And so this, we think this might be another route. And so I'll talk a little bit about our cleaning and disinfection guidance that goes along with that. Next slide, please. Okay, so some of the symptoms and complications. So the symptoms that are outlined on CDC's website are cough, shortness of breath or difficulty breathing, fever, chills, muscle pain, sore throat, and then new loss of taste or smell is a newer symptom that we've just included in the list. So there's a wide range of illness from mild to severe, and of course we know this can unfortunately result in death. The estimated incubation period is 2 to 14 days. And some of the major complications we know about include pneumonia, respiratory failure, and multi-system organ failure. So I have a link down here that says Symptom Self-Checker. This is a little robot named Clara who you can go onto that site, type in some of your symptoms, and it can provide some information on if you should be seeking care or not. So this is not a diagnostic, obviously, but it is a tool that we've created to help you think through what your symptoms are and what you might be able to do with those symptoms. Next slide, please. Okay, so a couple ways you can protect yourself and prevent the spread of this disease. One of the biggest ones is avoid touching your eyes, nose, and mouth with unwashed hands. We also promote social or physical distancing. So this is avoiding close contact with other people when you're not at home. And washing your hands often. So washing with soap and water for at least 20 seconds. And if soap and water are not available, then we advise using an alcohol-based hand sanitizer that has at least 60% alcohol. And then again, cleaning and disinfecting frequently touched objects and surfaces. Next slide, please. Okay, and then there's some other ways that you can protect other people, and this really goes across the board with respiratory illnesses. So the big one is, of course, staying at home when you're sick. We also promote respiratory hygiene. So this is covering your cough or sneeze with a tissue or using the inside of your elbow and then throwing away any of your used tissues and immediately washing your hands afterwards. We also suggest avoiding close contact with people when you're not at home. So again, the social distancing. And then wearing a cloth face covering that goes over your nose and mouth when you're in public. And this is especially in situations where you will be close to people. These cloth face coverings are not meant to be worn by children under 2 years of age, and also not meant to be worn by people who might have trouble breathing or are otherwise unable to remove them. And again, just an important note that we don't see these cloth face coverings as a substitute for social distancing. It's just another layered approach that can reduce some of your risk. Next slide, please. So again, social distancing is one of the most important tools we have to slow the spread. And staying 6 feet apart from other people, not gathering in groups. So I know this is a big issue in aquatics and something we'll talk more about in a little bit. Staying out of crowded places and avoiding mass gatherings. And again, this cloth face covering. I know we kind of keep repeating these messages, but these are really the big ones that we really want to get out there. And just, you know, a quick note, again, on these cloth face coverings, not for use if you're under 2 years old. And we really want to emphasize that surgical masks and other PPE, like respirators, are really intended for healthcare workers. And the big thing with cloth face coverings is these are these are preventative for the people around the wearer. So this isn't necessarily protecting you from others, but it's protecting others from your respiratory secretions if you happen to be, especially if you happen to be asymptomatic and still shedding the virus, but not know that you're sick. Next slide, please. Okay, so a little bit on cleaning and disinfection. I only have a few slides on this, but I do want to note that CDC, in collaboration with EPA, released a reopening cleaning and disinfecting guidance document on April 29th. So I encourage you to look at that. So the document really highlights 3 major principles for cleaning and disinfecting. So that they should be effective, they should be efficient, and they should be safe. So I'll go through each of those 3 really quickly. So cleaning and disinfection should be effective. What we say is that you want to clean first. So cleaning is just regular soap and water, and this is especially important if the surface is dirty, if there's any kind of organic or other types of materials on the surface that could impact the efficacy of your disinfectant. So always first clean, and then follow that with a disinfectant. So CDC advises using disinfectants on EPA's list in, and these are disinfectants that are to be used for surfaces that and are made for surfaces that may have SARS-CoV-2 on them. So importantly, follow the manufacturer's instructions for these products, and that includes the application method, and that's a really important one. We get a lot of questions about sprayers and other types of application of different disinfectants, and so you can go onto EPA's website and search by application method and come up with different options that might be best for your facility. So EPA has about 400 disinfectants on that list right now, and they're updating those weekly. And also important to make note of the contact time. Some disinfectants require a longer contact time. We also say that if list-in disinfectants aren't available, which may be happening in some areas, especially as places begin to reopen and everyone's buying disinfectants, you can also use just regular standard household bleach. So this is the bleach that is 5 to 6% sodium hypochlorite. And we suggest that you dilute that as 1/3 cup of bleach into a gallon of water. And this produces a disinfectant that's about 1,000 parts per million or milligrams per liter. Next slide, please. So our second principle with disinfection is that it should be efficient. And what we mean by that is that it's important to really focus on surfaces and objects that are frequently touched by multiple people. So a lot of examples of these: doorknobs, light switches, phones, faucets and sinks, handles, tables, countertops, remote controls. And really the way to really figure out what these surfaces are, it's very specific to your individual facility. So we do suggest developing a plan for your specific facility, and then you can tailor your cleaning and disinfecting schedule around that. So really noting which surfaces are frequently touched, which areas do most people congregate in, and then kind of coming up with your cleaning and disinfecting plan that's tailored to that specific venue and facility. So there are a number of surfaces that do not need to be disinfected. So surfaces and objects that aren't frequently touched. Walls, floors, sidewalks, ground covers. We get a lot of questions about should we be bleaching the sidewalks in front of our buildings? And we really just say that that's not the most efficient use of disinfectants. Really just need to focus on those surfaces and objects that are frequently touched. Also, areas that have not been used by anyone in the past 7 days do not need to be disinfected. So if your facility's been closed for at least 7 days, just normal routine cleaning, and then follow that with a regular cleaning and disinfecting plan for that particular facility. Next slide, please. And lastly, we just really want to make sure that the cleaning and disinfection should be safe. So staff who are going to be using these disinfectants, it's important that they really know exactly how to do this, how to apply the disinfectant, that they're using the correct concentration, that they have personal protective equipment that's according to the product's instructions, that there's sufficient ventilation for use of the disinfectants, and then of course keeping all of these disinfectants out of the reach of children and really just storing those appropriately. So that is it for me. I'm going to turn this over to Michele. So she's really going to kind of dig into some of the more specific considerations that CDC has come up with for public pools, hot tubs, and water playgrounds.
Thank you, Jen. And before I get started, maybe Daisy can put up the second poll question. Okay, next slide, please. Okay, so this part of the presentation is going to include considerations for the safety of those who operate, manage, and use public pools, hot tubs, and water playgrounds. All decisions about implementing these considerations should be made locally and in collaborations with local health officials. Next slide. Okay, so in this part of the presentation, I'll be covering promoting behaviors that prevent the spread of the virus that causes COVID-19, maintaining healthy environments, maintaining healthy operations, and preparing for when someone gets sick. Next slide, please. Okay, so the first part, promoting behaviors that prevent the spread of the virus that causes COVID-19. Next slide. So here we're talking about encouraging good hand hygiene and the wearing of cloth face coverings. So one thing to consider is to encourage all staff, patrons, and swimmers to wash their hands often and cover their coughs and sneezes. To go along with this, we ask operators to ensure that they have adequate supplies to support healthy hygiene. So that means soap, hand sanitizers, paper towels, tissues, and no-touch trash cans. We also ask operators to consider encouraging the use of cloth face coverings as feasible. As Jen had mentioned earlier, the cloth face coverings should not be worn in the water. When they get wet, it's hard to breathe through them. Next slide. We're also asking operators to consider educating the staff, patrons, and swimmers about when to stay home. For example, if they have symptoms of COVID-19, if they've tested positive for COVID-19, or if they were exposed to someone with COVID-19 within the last 14 days. Next slide, please. We're also asking operators to consider posting messages about how to stop the spread of the virus that causes COVID-19, proper hand washing, signs that promote everyday protective measures, and the proper use of cloth face coverings in highly visible locations. So we don't want these signs to be posted behind a pole. We want them at the entrance of decks. We want to make sure that patrons and swimmers and, of course, the staff can see them. CDC has a series of print resources, and there's a link to those at the end of the presentation. Also, CDC has examples of announcements that can be made regularly on the PA system. The messages about behaviors that prevent the spread of the virus can also be included in contracts, whether they be with individual patrons or with households, in emails, on facility websites, and through the facility social media accounts, as well as on entrance tickets. Next slide, please. Now let's talk about maintaining healthy environments. Next slide. So like Jen had spoken about earlier, cleaning and disinfection are an important pillar to preventing the spread of the virus. We're asking operators to clean and disinfect frequently touched surfaces. So if people are touching a particular surface like handrails, they should be at least cleaned daily, and shared objects should be cleaned between uses. So what kind of surfaces or objects are we talking about? We're talking about handrails and slides and structures for climbing and playing. We're talking about lounge chairs, tabletops, pool noodles and kickboards, door handles, surfaces in restrooms, hand washing stations, diaper changing stations, and showers. And what I really want to emphasize here is cleaning is really important before we do the disinfection. The disinfectant isn't going to work as well if the surface isn't cleaned first. The oils from hands and other dirt and schmutz or whatever is going to protect the virus from disinfectants if we don't clean it off first. We're also highlighting, as Jen had said, the list and disinfectants approved by the EPA. Talk to the manufacturer or the designer of the aquatic venue to figure out which of these disinfectants are best for your aquatic venue. There are over 400 disinfectants listed. Some of them might cause damage to surfaces or objects. So keep in mind it's good to call the manufacturer or designer to figure out what works best for your particular location. And most importantly, we've been hearing a lot in the news about chemical injuries. We want to make sure we use the chemicals correctly, following the label directions, and we store them safely. And this is also going to include storing products securely away from children. We don't want children accidentally ingesting these or inhaling these chemicals. Next slide, please. Maintaining social distancing. So this is a really important step that we all need to be taking, and what we might be able to do to help our staff and patrons and swimmers to maintain social distance, which is at least 6 feet apart from those we don't live with, is to change the layout of the decks to ensure that individuals are keeping social distances. We're talking now about providing physical barriers and guides, physical cues such as, lane lines in the water or chairs or tables on the deck, visual cues such as tape on decks, on floors, on sidewalks, and then again signs just to remind everyone to stay at least 6 feet apart. A good reminder that I have found for pools or that we associate with pools is a pool noodle. So pool noodles are typically around 5 feet. So we say if you can touch someone with a pool noodle and you don't live with them, you're too close. Next slide, please. Communal spaces and shared objects. So here we're talking about, staggering the use of communal spaces, for example, in the water or in a break room. We want to make sure that we're cleaning and disinfecting frequently touched surfaces, at least daily, more frequently, based on the level of use. Discouraging people from sharing items that are difficult to clean, sanitize, or disinfect, or that are meant to come in contact with your face, such as goggles, snorkels, or nose clips. We're also discouraging the use of sharing items such as food, toys, and supplies. Next slide, please. Maintaining healthy operations. Next slide. All right, so here we're talking about staffing and what we can do in terms of staffing. We want to consider protections for vulnerable staff, so staff that are more likely to develop severe COVID-19 if they become infected. So people 65 years of age and older, people with underlying health conditions. So examples of protections could be teleworking, working from home, modified job responsibility with less contact with a number of people. Ensuring that lifeguards who are actively guarding aren't the ones who are monitoring the hand washing, use of cloth face covers, or the social distancing. Those who are actively lifeguarding should only be actively lifeguarding. We don't accidentally want to have more drownings this summer because the lifeguard had other responsibilities while they were lifeguarding. We want to implement potentially sick leave policies and practices for staff that are flexible and non-punitive, train staff on all these new safety protocols. So we're operating and managing our pools like we always have, but now on top of that, we're adding a whole bunch of additional steps to make sure we're minimizing the risk of the spread of the virus that causes COVID-19. Operators might want to consider conducting daily health checks, for example, temperature screening or symptom checking of staff. Next slide, please. Gatherings at pools, we want to make sure we don't have group events or gatherings or meetings in or out of the water if social distancing of at least 6 feet between people who don't live together cannot be maintained. Exceptions to our social distancing guidance include rescuing a distressed swimmer, providing first aid or performing CPR. Public pools should not be open if we aren't prepared to rescue a distressed swimmer, and of course that means getting closer than 6 feet to that swimmer. Individuals in the process of evacuating an aquatic venue, for example, if there is someone drowning in the water, if there's a fecal incident in the water, or if the facility is being evacuated due to an emergency, at that point we're more worried about getting people out of the water or out of the facility than we are about social distancing. We also want to be aware of local and state regulatory agency policies on gathering requirements and not to exceed local or state limits. Next slide, please. Preparing for when someone gets sick. Next slide. Here it's, the operator needs to make sure that if someone becomes sick at the aquatic venue, that person, the sick person, is isolated and transported either home or to a healthcare provider. you immediately want to separate the sick person from staff, from patrons, from swimmers. And you want to notify health officials, and you can work with health officials to then notify close contacts, whether those are staff, patrons, or swimmers. Next slide, please. And preparing for someone gets sick, you want to have a plan in place. What happens if someone gets sick at your aquatic venue? It's about, again, cleaning and disinfecting, and thinking about closing off that area used by the sick person until cleaning and disinfection can take place. Waiting for more than 24 hours before cleaning and disinfecting the area. You want to make sure the droplets are settled. And then you want to make sure you're using, again, those list end disinfectants after you've cleaned to disinfect the surfaces. And you want to make sure you're using them safely and correctly. And we want to make sure that they are secured away from children. Next slide, please. And here are the resources that Jen and I have been talking about throughout. These are links to the resources. Next slide, please. And here's our contact information. And if you have any questions for Jen, myself, or Dewey, and I guess I'll turn it over to Daisy and Joe, and we can go into Q&A.
Thank you so much, Michelle and Jennifer. So now we're going to move on to our Q&A portion of today. We have been receiving lots of questions in the Q&A box, and we have plenty of time built in today's webinar to address as many of those questions as we can. I just want to remind everyone that the recording of this webinar will be available. We'll be sharing that with you in information on how to access and download it together with the slides following today's webinar. We'll also be putting together a Q&A summary that will also be posted in our website, and so you'll have instructions in how to access that as well. So I'm going to start with reading some of the questions here we received in our Q&A box, and our panelists will be addressing them. So today's first question, one thing that I have not heard addressed anywhere today yet is transmission from nasal passages secretions in the water. While I suspect that chlorine should quickly inactivate the virus, I don't know how quickly or that's been even studied yet. I also wonder if there had been any studies on transmission to other individuals given the amount of contact from mucosal membranes in the eyes, nose, mouth, and throat, and have others during active pool use or going underwater. So the same information except for chlorine pad would be relevant to beach as well. Do you guys have any information on that, Michelle or Jen?
Sure, yeah, this is Jen. So there's still a lot we're learning about this virus, but to date, we don't have any evidence that there has been transmission through water, either treated or untreated water. So we think that the risk is low for that. And of course, chlorine is an excellent disinfectant. It's one that we suggest for using on surfaces. We do, just to point out again that surface disinfectant solution that is up on our website does produce a very high concentration of sodium hypochlorite, so 1,000 parts per million, which is, up to 1,000 times higher than what's in pool water. So a lot of this has to do with contact time. So when you use a disinfectant that's that strong, it really does just shorten the contact time that's needed on the surface. But we don't expect that this virus is going to behave much differently than any other similar type of virus. Studies are probably underway as we speak to try to get a CT value for this particular virus. We do have a little bit of data from MERS and SARS-1 that suggests that it is susceptible to chlorine. So we're just staying on top of the literature and watching to see what kind of numbers come out. And of course, we'll amend our recommendations as we need to.
Okay, great. Thank you so much, Jen. So our next question is asking about social distance. Is there a template on how to achieve social distance and other mechanisms once schools can reopen?
This is Michelle. With social distancing, I think this is more than anything the key to having healthy and safe experiences at pools this summer, or at beaches actually too. Making sure we can stay at least 6 feet away from anyone we don't live with. There is no formula per se. It is about the 6 feet. One thing you know, we had discussed here at CDC was the possibility of maybe just limiting numbers to the number of people that can safely socially distance on a pool deck in case the water needs to be evacuated because of a rescue or because of a fecal incident in the water. Things can become a little constrained when you don't have the water as a possible area for people to disperse in. Right now, the way the guidance is written, if you have a lot of people at the pool will likely need to be closed if you need to evacuate it, or at least temporarily closed. There might not be enough room on the deck, but it is basically, when it comes down to it, it's just being able to maintain the 6 feet in or out of the water.
Mm-hmm. Okay. Thank you so much, Michelle. So I'm going to be combining here. We're receiving lots of questions. So if we don't read your question verbatim, we're just trying to answer as many questions as we can as we go through this. So I think now we're going to be moving on, talking a little bit about disinfecting surface and cleaning surface. So there were a lot of questions asking about how often, if there are, how often would you recommend every 15 minutes, or if there's any guidance on that. And there were also a lot of questions related to the different materials used around the pool. So if, how can you clean those as well? So for example, pool noodles or kickboards, and things like that.
Yeah, sure. This is Jen. So we get a lot of questions about frequency, and that one's, harder for us to give specific guidance on. I think that really is site specific. And again, we really encourage developing a plan before you reopen, and thinking through those high touch surfaces. So really focusing on the high touch surfaces in your facility. And that may include things like handrails and, light switches. Bathroom faucets are a big one, door handles. Really focusing your disinfectant use on those types of surfaces. And it's as feasible and what's practical for your setting. And you'll know your setting better than anyone. And, certainly, facilities change on a day-to-day basis. So, if it's a slow day, that's a little different than if it's a super busy day. And I think you probably, as we all learn how to work in this sort of new time, we have to just kind of adapt. You may see that, this year you've got a lot of people congregating in this one particular space that's a little different than what's done before. And so you kind of have to amend those plans, that schedule, and really creating a schedule and keeping that, very clear for your staff. This is the frequency. What we say in our guidance is at least daily, but more often depending on level of use. And I know that seems a little vague, and I think that's really just meant to say, this is something that we think that groups can kind of determine on their own and really strategize how that works best in their particular facility. Again, there's a lot of different options for disinfectants on that EPA list. So I encourage you to look at those, look at the application methods, see which application method works best. Again, as Michelle mentioned, You want to use something that's going to work with the particular surface. Wipes might work in some cases. You may, have solutions that you use for other things. I know some objects are kind of challenging. Pool noodles might be tough, and so one thing that we've suggested in our guidance is to clearly label some bins, right? So these are our dirty or used ones. These are our disinfected ones, and kind of stagger use of those so that you have time to do some adequate cleaning and disinfection. Having enough available on hand would be ideal so that there isn't sharing or use between people. Coming up with a plan for how to, how frequently to clean those. Ideally it would be in between use because those types of things do touch faces and hands. There are certain objects we think that probably just might be better not to have available, and those are things that would touch mucous membranes. So goggles and snorkels, those are a little harder to disinfect in between use. So it might be worth considering just not having those available at your facility. If people, bring their own in, that's kind of a different situation. But again, I think you just kind of have to tailor this this cleaning and disinfecting to your particular facility. I hope that helps. I'm happy to follow up with some more info on that if there's specific questions.
Yeah, I follow up on that question, Michele. So how about other objects that may be in contact with water, maybe, water rafts, or even chairs that may be in touch with the water? Should that be following the same guidelines and instructions as you just described?
Yeah, so we should be cleaning and disinfecting surfaces as we've been discussing. It is about using a disinfectant. I wish I could tell you that pool water was on EPA's list. It would make things a lot easier for our pool operators, but it's not. The concentration is much lower. We don't know what else is in that water, if there's actually any chlorine in that water sometimes, if we're talking about, sprays and whatnot, and all these things that can deplete the chlorine in that water. So we really need to be focused on cleaning and disinfecting with disinfectants on EPA's list.
Thank you so much. I think we're now going to move on and discuss a little bit about lifeguards. There were a lot of questions coming in about lifeguards, that they should be wearing some type of facial covering, or how do you complete lifeguard in service, so like practicing rescues, CPR, and other scenarios.
Dewey, do you want to chime in here?
Oh yeah, absolutely. I was waiting for a little bit more specific question, but the actual answer is, you have to look and see what your local guidelines are, your local jurisdiction guidelines are, as well as what the training agencies have released. Pretty much all the major training agencies have released some form of interim guidance on training. There's been a lot of really interesting ideas promoted or mentioned. Obviously, using blended learning is one, and creating Zoom sessions for some of the cognitive information, lecture information, and even creating individual skill sessions to where you can still practice social distancing while covering individual or single person skills. This is going to be largely a matter of what's reasonable and what's practical for your situation and what's allowed by your training agency. I do need to caution that there has been some talk about the practice of using family members to be victims and secondary rescuers. I just do want to caution that defer to your agencies on those protocols, there is a real risk of individuals coming in not being properly screened, not being properly prepared, being used as victims, quote unquote, and running into a risk of drowning or becoming a distressed swimmer. So the honest answer is, as long as social distancing requirements are in place, it is going to be difficult to complete in-service train, or not in-service training, but lifeguard training for staff and students. It's going to be very difficult to do that. You can put in place some things to move along in that training, but you're going to hit bumps where it's multiple rescuer scenarios, whether it's backboarding, for example, where it will be difficult, if not impossible, to do without social distancing guidelines being relaxed. I did see a couple of questions in Daisy. I'll just cover what I've seen in the chat box a little bit about in-service training, which is along those lines. We're still going to run into the same issue in that whether we're discussing in-service training or preseason training, the ability to test and evaluate physical skills will be greatly limited because of social distancing. For in-service training, I would just encourage facilities to put their creativity hat on and see how can they check off, so to speak, on some of these criteria using what's available, whether it be web-based meetings, whether it be mini lecturettes recorded by the trainer for the facility and posted on social media in a private manner. That's something that can be done. And even down to arranging for staff to practice CPR skills on individual mannequins. Those are all interesting things and interesting possibilities to address the in-service training issue. In regards to resuscitative care, CDC at least guidelines and recommendations, as well as the American Heart Association, part of those recommendations include the use of a HEPA filter in resuscitative equipment. We are also seeing recommendations to use BVMs alone versus the individualized pocket mask and resuscitation mask, again with HEPA filters. I do want to caution you not to necessarily fashion your own HEPA filter, but contact the manufacturer of your resuscitation equipment and see how they can integrate HEPA filters into that equipment. An example is with BVMs. BVMs are based on a certain tidal volume, and if you're manufacturing your own HEPA filter without any sort of quality controls, you may be interfering with the volume of air delivered by that device. And that's certainly not something we want to see happen.
Dewey, would you be able to talk about some of the creative and innovative ideas in regards to swim lessons and swim teams?
Sure, absolutely. In regards to swim lessons, there's been a lot of discussion about how we can teach, because obviously social distancing impacts a variety of different skills and different currently used methods. For younger levels, regardless of what program you're using, but those that require high amounts of hands-on work, one solution that's been proposed has been to include a family member. So you have, the common parent-taught type classes, parent-child classes, where a parent is in the water working with that child. Those can be extended up to a little bit higher levels, again, where you're practicing basic floats, basic propulsion, where the students still need a high amount of hands-on work. So that's certainly something that's been proposed out there, which is a great idea to work around. there's been some discussion about station teaching, and station teaching is not a new development. It's been around for quite some time. There are some hangups, such as if you're using station cards, those would need to be properly cleaned between each use. So there are its own unique methods, but especially for older learners that do not need as much or any personal contact by the instructor, that's something that can be valid to be used. And then the station teaching would also allow for proper social distancing. You'll also have to look at, and again, being totally honest, looking at how many modifications you need to make to your program. Obviously, reducing the amount of students per class may be something that has to happen, again, to maintain proper social distancing. And in some cases, you may have to evaluate whether or not you are going to offer certain levels, period. You may, in your various phased reopenings, only wish to offer upper level instruction where you already have basic essential swimmers, but they're working on technique. And at that point, the instructor can be on the deck providing instruction for the student in the water. There is a concern about skill demonstrations there, but again, that's where we have plenty of resources from a web-based or technology-based standpoint to where instructors can pre-record themselves doing certain drills, or you can use pre-made videos for skills available by the various providers. So the swim lesson issue is really just, is it feasible financially for your organization to continue on? What modifications can you make for those skills to maintain social distancing, and how creative can you get? Swim teams tend to be a little bit more of an interesting problem to work through because generally, for most swim teams, we don't have the ability to put one swimmer per lane. USA Swimming has put out some interesting solutions to that, where you're breaking the pool in half and doing staggered sets. Again, you just have to look and see, all right, how can I make modifications for my swimmers? If I have a 6-lane, 25-yard competition pool, to follow social distancing, I may only be able to have one swimmer per lane. So I may have to reduce the amount of sets that are used, reduce the total time, and adjust my training plan. It may be that we can use staggered forms, where we're doing shorter distance swims, more training, more drills to get them in the water, but we're still able to maintain social distancing. So again, the issue there is going to be creativity combined with what is feasible and what's practical, and how you as a swim coach or a facility can creatively find solutions to where you're still adhering to social distancing, you're still adhering to your capacity guidelines issued by your jurisdiction, but still working on training and leading the team.
Thank you so much, Dewey. Maybe now we can move on and discuss a little bit about airflow. So there were a lot of questions asking if there are any recommendations in the flow of air, if it's especially is in indoor pool facilities, and if that's one of the recommendations, and what would that be?
This is Michelle. So if the facility is an indoor, if the venue is in an indoor facility, we do say open the doors and windows to get as much fresh air in as possible. Make sure your ventilation system is working optimally. You do want to maximize the amount of fresh air getting in. However, if it is unsafe to do so, to have the doors open, to have the windows open, we recommend not doing so.
Thank you so much. Now, one of the questions here, and I'm just going to read this one verbatim that has been put it on here on the Q&A box, and for some people it's about mitigation strategies for fast-flowing natural rock bottom hot springs in where any use of chemical disinfectants could cause environmental damage. I know it's a very specific question, but wonder if there's any guidelines on that.
Hey, this is Jen. I will take that one. We don't really have any guidelines on that yet. I think it's a really important question. We have given some. We've had some chats about natural springs or natural hot pools. Again, we don't think that there's a risk of transmission through water. Again, you have to really think about aerosolization. That's still something to consider. And really just, I think maintaining the social distancing is super important. And, trying to stay with people that you live with, especially if you're in smaller settings like small pools. But, no guidance yet from CDC on adding any type of disinfectant or treatment to natural pools. If that changes, we will certainly get that up on our website.
Thank you so much, Jen. The next question is talking about circulating and non-circulating splash pads in respect to COVID-19, and there's any specific guidance on that.
Michele, I'll take that one. So splash pads, interactive fountains, interactive water play venues, water playgrounds, whatever we call them, they're basically pools with the standing water underground. We would treat them just as we do treat pools. Again, as Jen and I have said, we're not aware of any data that tell us that this virus can be spread through water. What I'm more concerned about when it comes to water playgrounds is the potential for crowding. Usually when I see water playgrounds, I see a crowd of people there. If we are going to open water playgrounds, we strongly encourage the operator to ensure that people are staying 6 feet or more apart if they don't live together.
Mm-hmm.
And this is Joe. There's also going to be some considerations that are needed when there are children in place. They're going to be the ones that are going to typically be engaged at a water playground or in a smaller, shallower, wading pool. So there are going to be some circumstances that make it more challenging to maintain that social distancing. A couple other examples that I saw in the questions also are related to lazy rivers and wave pools. Yes, with the movement of water, that is going to be extremely challenging for people to stay away from each other.
I want to pop in real quick, Joe, Daisy, Michelle, if I can, just from an operator perspective, right? As an operator, we see the guidelines come through, and what we have to do is we really have to look at our operations, and we have to determine what's feasible, what can we do. We are all wanting to get back to normal. We're all wanting to reopen our facilities to our patrons and our bathers. But at the end of the day, we do have to make these considerations about, do we have the ability to adequately clean and disinfect during operational hours? Do we have the ability to adequately space out and follow social distancing with this particular feature, whether it be a spray ground, whether it be a spa, whether it be a lazy river. You know, from an operational standpoint, you aren't necessarily limited apart from social distancing. You can certainly leave lazy rivers open, but it'd have to be restricted to one person at a time or a family unit at a time because of the trouble with flowing water, as Joe mentioned, in maintaining social distancing. So again, just putting my operator hat on, I would encourage all of those operating facilities, just before you open, just take a look around, take a walk around, and really examine your features and find out and think about, is this practical for me to open and have operating?
Thank you so much, Dewey. Going back to social distancing, one of the questions was, would you consider that pool occupancy capacity rates listed in the MAC to be adequate for maintaining a 6 feet of distance between beta, and any recommendations that you have for reducing pool and deck occupancy rates?
Just to clarify on the MAC, and this is Dewey, the MAC is not based off, the MAC occupancy rates and capacities are not based off pandemics. They're based off of a separate formula, and those capacities would be far more than what you're looking at to maintain proper social distancing in a pool.
This is Jen. Just to follow up on that, was a good point. I think it's important that you work with your local jurisdiction on any rules around gatherings. That may be different in different areas. CDC wasn't prescriptive in that kind of thing. We did talk about that quite a bit, but kind of just landed on letting that be a per venue decision based on how well social distancing was functioning within your facility. So again, that's a really good conversation to have with your local jurisdictions, health officers, especially around any restrictions or guidelines on numbers of people in a particular setting.
Thank you. The next question is asking about clarification on the use of UV light or ozone for surface and air disinfection.
So I can try to take that one. So UV light, we know, can be effective in inactivating viruses. Right now, we don't have any guidance on use of UV light. We know there's a lot of groups who are investigating that as a potential option for this virus. We just kind of keep going back to the surface disinfectants on the EPA's list. So we do get a lot of questions about UV, whether it's important to put in air duct systems or for surfaces. So we don't yet have any guidance on that, but that may change. Again, UV, if it's used for water treatment, certainly is still something that I think is a great option. So we'll keep our site updated as we learn more about this virus.
And to follow up with what Jen just had to say too, we sometimes get questions about utilizing the sun as a way to disinfecting your outdoor surfaces or chairs or equipment, and that's not going to be always reliable. There's just too many variances there based on your latitude, how cloudy it is, how long the exposure is. So right now, we're really recommending the list N on EPA's site as approved disinfectants to inactivate our virus.
Thank you so much, Jill.
I saw one other
Go
question that I'll answer about screening and doing temperature checks of staff and or patrons before they come in. That's definitely a way to provide you with more information about some symptoms that may be related to an illness, including COVID-19. But I think it's also very important that everyone's aware of the asymptomatic carriers, and that people can be infected and contagious and not exhibit any symptoms at all. So I wouldn't rely on those temperature screenings too heavily, because someone could not be exhibiting any symptoms and get through. And also someone could take, some ibuprofen because their knee hurts, and that could also lower their temperature if they had one.
And this is Michelle, and to that I would add, CDC has guidance on how to do screenings more safely, because if we're going to start taking temperatures or whatnot, we're going to have to be less than 6 feet apart. So there are steps you can take to do it more safely.
Mm-hmm. Thank you. So the next question is asking, would there be any call for pools to test their water disinfectants such as chlorine or bromine more frequently throughout the day to ensure that the disinfectant levels are more closely maintained for the virus inactivation?
This is Dewey with CMAHC. No, I mean, there's if as long as you're following your code and you're testing appropriately per the code, and of course I recommend per the MAC, no, there wouldn't be any additional need, provided that your disinfection systems are in place to maintain chlorine and pH appropriately between the non-testing areas. So you can follow your already established testing criteria, again, unless you see other cause as inconsistencies in your testing, failure of equipment, and things of that nature. And while we're here, one other thing to kind of mention is that make sure that you are in code compliance. As Jen mentioned earlier, we don't have any indication that COVID-19 is spread through water. As long as you're maintaining your code compliance, right? So your chlorine, minimum of 1 part per million, max of 10, your bromine, minimum of 3 part per million, in conjunction with an appropriate pH, 7.2 to 7.8, that is adequate. There is no need to hyperchlorinate or run a higher than normal chlorine level. So those things are unnecessary. Again, unless you're seeing other issues, for example, your chlorine demand is high enough, your bather load is high enough to where you're having difficulty maintaining a chlorine level, you might need to increase your chlorine level to accommodate for that bather load. But those are separate issues from COVID-19.
Thank you, Dewey. I think some of the questions that I see here, going back to social distancing, so some of the questions were asking, what about times where social distance maybe not be achieved? For example, maybe there's, a thunderstorm coming. Do you recommend some people to their cars? What would you in the indoor facilities? Or even if you have like a very small pool area, and would maybe just wearing a mask be sufficient if there is no way to maintain the recommended social distance measures?
So, as we have said earlier, in situations where there are emergencies, social distancing isn't as important. We want to make sure distressed swimmers are rescued. We want to make sure people aren't swimming in the water when there's fecal contamination, or now if we observe some thunder and lightning in the area, we all need to get out of the water. Depending on the situation and depending on the structure of the aquatic venue, everyone might be able to social distance on the deck. If not, then maybe it's time to close the aquatic venue. We don't want to stay open if we can't socially distance.
Thank you. So we're still going through some of the questions here. Feel free to continue submitting your questions via our Q&A box, and you can always vote a question up to if you like that to be answered. One of the questions that were asked prior to the webinar, and I don't know if you guys want to touch a little bit too, is regarding liability. Are there any recommendations or suggestions having like a waiver at the entrance of the center, or any concerns about liabilities for opening the pool?
That is really more of a concern for your legal counsel. I know that's outside of CMAHC's purview. If you have any liability concerns, obviously you need to be consulting your risk manager for your facility. You need to be consulting your insurance company and carrier, and even possibly your counsel. Those would be the absolute best sources to go to on anything related to liability, regardless if it's an operational question or a training question or a programming question.
Mm-hmm. Thank you so much, Dewey. There were some questions here asking about if the same recommendations and measures should be used in also in beach, and if there is any greater risk in saline pools.
I can take that. So with saltwater pools, keep in mind that when we run the electrical current through the water in which there is basically, dissolved table salt, we are creating the same chlorine that we create when we add regular pool products to a pool. So there should be no difference there. The one concern you might have is if you don't have enough cells generating the electrical cells generating enough electricity, you might not have enough chlorine generated. So it's, again, maintaining that disinfectant level where it needs to be in a saltwater pool as you would in any other pool. In terms of what to do at beaches, we are currently working on guidance for beaches, and honestly, in a lot of ways, it's not going to be that different. Yeah, we're not putting chlorine into the water, but we right now don't have any data that tell us that the virus is transmitted through water or spread through water. It's about the social distancing, and if we can't social distancing, wearing the masks. So I don't foresee the guidance for beaches being dramatically different than what we're seeing for pools. It's about the social distancing. It's about wearing the cloth face cover, hand washing, cleaning and disinfecting surfaces.
Thank you. So some people have asked about disinfecting cash and using, if using cash around, the pool facility, if there are any recommendations around that.
This is Jen. We have in other guidance documents noted that it might be a good strategy to avoid using cash just because of the handling component. That may not be possible in all cases. So if you're able to use a no-touch payment system, that certainly would cut down on any of the hand transmission. I think if you do end up needing to use cash, it's important that there is hand sanitizer available for the person who is taking the cash, and maybe even for the people who are handing it over. So making sure that hand hygiene is there. If you have a cash concessions, or you have cash to get in, maybe that's a good place to post signs about hand hygiene, and really just reminding people about that, and making sure that they are focused on that as a possible transmission surface. But I think it just depends on your facility and what you're able to do. So there certainly are some ways to reduce that if you can go cashless.
Thank you. Some of our next questions are related to either small pool facilities, or small community pools and spas that may not have a lifeguard, per se, on duty. Do you have any recommendations of opening the pool with the data load that is required by the state, following the guidelines? Is leaving out sanitizer and cleaning supplies enough for the residents, and then hiring a cleaning company once a day should be sufficient, or if there should be, a person or staff member there to make sure people are applying to the social distancing and the guidelines?
That's going to be a local discussion with local public health, and to see where the numbers are and how best to move forward. And as Dewey said earlier, maybe even legal counsel to figure out kind of what is the best position to take legally on how many people you bring in to clean, and how you can share responsibilities and not share responsibilities. But definitely at a minimum, a discussion with local public health.
Mm-hmm. Thank you.
Jen, Michelle, we just recently got another question in about face shields. Would you guys be able to explain for our listeners here the difference between face coverings and face shields?
Yeah, sure.
Or I can start, or go ahead, Jen. Go ahead.
Oh, you could go ahead. I can follow up.
So when we're talking about face shields and we're talking about face coverings, we're potentially talking about two very different things. When I think face shields, I think kind of that plastic sheet that goes in front of your face, and I think about droplet protection, prevention of contact with droplets, and I think about wearing a surgical mask. So basically what I'm saying is, when I think face shields and surgical masks, I'm thinking about equipment or personal protective equipment for healthcare providers. The cloth face coverings that we've been talking about that you shouldn't wear in the water, those are for the public. But when we talk about face shields and surgical masks, then we're talking about healthcare providers. And we don't want to be using things that our healthcare providers are finding a hard time getting their hands on, because they're exposed to much more virus than the rest of us. That said, in terms of a rescue, that might be a different discussion when we're talking about lifeguards. But Jen, do you want to add?
Yeah. So yeah, just to reiterate, face shields or cloth face coverings are not PPE. So the cloth face covering isn't intended to protect the wearer like a face shield would be. It's really meant to prevent the spread of the virus from the wearer to others. So, OSHA has suggests that some workers wear face shields if a cloth face covering is recommended and the worker can't tolerate wearing the cloth face covering, but really that face shield is meant as more of a different type of, has a different use, so more for certain job duties. So I think, each person has to kind of make a choice what works best for them. But CDC kind of keeps going back to the use of the cloth face coverings.
Yeah, and by design, the face shields are not designed to provide any kind of respiratory protection. They're primarily designed, for impact protection.
Thank you for clarifying that. Some of the questions we have received are around fecal accident in the pool. What is your recommendation, following the current protocols? Is following the Giardia and crypto inactivation enough, or is there any additional recommendations for those situations?
Based on the data we currently have, we have not changed our fecal incident response recommendations at CDC, and therefore the MAC is staying consistent as well.
It's important to note that COVID-19 is much more susceptible to chlorine than Giardia, crypto, and the other bugs found in fecal incidents.
Thank you. And another question here has been around the number of swimmers per lane. Do you recommend maybe having 2 swimmers that start on opposite ends, or there's another question here about having a swimmer in every other lane? Do you have any specific recommendations for that?
As an operator and just looking at the issue, you have to look and see, and again, we go back to social distancing. Most pools are built with 7-foot lanes. So if you have a lap swimmer staying in the center of the lane, then effectively they can keep 6-foot social distancing. So you could, in theory, have multiple all lanes used during a lap swim or fitness swim time. If you have an older pool with more narrow lanes, then yes, you may need to look at skipping and usually using every other lane to maintain social distancing. I saw a question earlier about lap swimmers starting at one end of the pool. You're still going to run into an issue of maintaining social distancing as they pass. Now, granted, typically when you swim, the exhalation phase of the breathing cycle occurs in the water. That's going to be true for most strokes. However, an important thing to keep in mind is not everyone swims the exact same way. When you're swimming a technical freestyle, technical butterfly, technical breaststroke, the exhalation phase all occur in the water. But when you're using some of the more modified strokes, or for example, a resting stroke like elementary backstroke, or a competitive stroke like backstroke, back crawl, or a modified stroke, most individuals over the age of 45, 50, they probably learned an older style breaststroke where the head stays out of the water. So you would really have to evaluate the level of swimming by everyone involved before you even think about, trying to have 2 people per lane starting at opposite ends. Because again, you're going to wind up with that distancing issue as they pass. And depending on the stroke they use and the form they use in their technique, you may wind up with people forcefully exhaling on each other in very close proximity, which is certainly going to be put them in a higher risk category.
Thank you, Dewey. There was one question earlier on that we're asking about groups larger than 10, and that still applies. Do you guys have any recommendations for large gatherings in the pool area?
So this is Michelle, and this is again, we're going to refer to the local jurisdiction or local community. They're going to set limits on how many can gather. But we can consider, for example, let's say the limit locally is 10 people. Then you could have potentially a swim lesson where if it's young kids or parent-child pairs, like a parent in the water with their child 4 times over plus the instructor, you're under 10. That being said, you know, numbers might be higher, but it's really about keeping that social distancing then if your gathering limits are higher. It's 6 feet or more from people you don't live with, and it's about wearing the cloth face covering outside the water. Mm-hmm.
Thank you all. We're getting to the end of our webinar here, so I just want to reiterate for those, for our participants, we will be compiling some of these questions and answers. We're going to be putting out a summary. You also will have access to this webinar recording and the slides available to you as well. So with that, I just want to open up for our panelists one more time for any closing comments before we end this webinar today.
Sure, this is Jen.
Well, this is Joe.
Oh, sorry, go ahead, Joe.
Yeah, I just want to take the time to thank our panelists and thank our speakers, Dewey, Dr. Murphy, and Michelle, for giving us quite a bit of your time this afternoon. And I really do appreciate the number of people that came to participate today in this webinar. I think we had over 400 people for most of the time. Thank you all.
Yeah, just thank you as well, and we're happy to be here and speaking with everyone. We hope you find our considerations documents helpful. We actually have a number of them that have just been released for businesses and colleges and universities, and some decision trees. We hope that everyone finds those useful, and we really do look forward to feedback and how this rolls out for groups. And please feel free to reach out if you have additional questions.
Yeah, so this is Dewey again. I know, echoing everyone else, I want to thank NACCHO for putting this on. It's and opening up to so many people. These are interesting times and definitely difficult times, and allowing this mechanism to get information out is absolutely critical. Lots of really good questions, so I just want to applaud the attendees for the questions they put in. And the level of thought they're putting into it. I hate that we couldn't get through all of them, but you know, it's really, as a group of attendees for NACCHO, I'm really impressed by the level of questions that have come in. My closing note is more of just remember that we are in unprecedented times, and oftentimes we want really firm answers. And unfortunately, in a lot of things, there may not be firm answers. Again, I would just recommend take a moment, take a breath. If you're a facility operator, look at your pool. We see what the CDC guidelines are, and really spend some time thinking critically how they can be implemented and what impact they may have on operations. Because at the end of the day, every decision is going to be a local decision. You know, at the end of the day, and so it's really difficult to give exact guidance on every particular situation.
And this is Michelle, and I echo what's been said, and just thank you for your interest in healthy swimming and promoting it. And have a good holiday weekend.
Well, on behalf of NACCHO, I want to thank everyone who attended today's webinar and our guest speakers who are here. Thank you so much for taking the time. And we will be following up this information with you. We hope you have a great weekend. And this concludes today's webinar. Have a great day.